This is the clamshell exercise. It's a simple therapeutic exercise that can be used if you're having issues with the deep stabilizer muscles in your hip, including the notorious glute medius and glute minimus muscles. And I'm going to show you 3 common mistakes to avoid with this movement if you want to get every ounce of effectiveness out of this little exercise and take your glute medius rehab to the next level, allowing you to come back stronger. As always, to be mindful of your time, I'll show you the secret sauce first, and then if you want, you can stick around and learn a few extra geeky details that will continue to help you out. And if you appreciate that I'm trying to front load this content to respect your time, then please consider hitting the like button. So here we go. The first mistake to avoid is pulling your thighs too close to your chest for the starting position. To maximize the work done by the glute medius and glute minimus, which are 2 of the primary muscles we're trying to target with this movement, you'll want to aim for about 30 degrees of hip flexion. If you pull them up any higher than this, you'll start to engage more of the glute maximus muscle to a much greater extent, allowing it to take over and dominate the movement. And when this happens, it lets glute medius and glute minimus off the hook a bit more, minimizing the effectiveness of the clamshell. And this is important to know because glute max is a powerhouse muscle. It's about 20 times stronger than glute medius, so we definitely want to keep it doing as little work as possible here. Now, something really important to understand is that the glute max has half of its fibers attaching directly onto the femur, making it a very powerful external rotator and abductor of the hip, in addition to it being a hip extensor muscle. As such, if we're in about 45 degrees of flexion during the clamshell, we're probably getting equal recruitment of glute minimus, glute medius, and glute maximus. And just so we're clear, this isn't necessarily a bad thing. But if your goal is to pick on glute medius as much as possible with this exercise, then aim around for about 30 degrees of hip flexion as you set up for the movement. And the second mistake to avoid is not keeping your belly button pointed towards the floor as you lift your leg. When your belly button is slightly pointed towards the floor, it rotates your torso down slightly, and this simply helps to ensure you knock out glute maximus a bit more, again, making it a bit harder for this powerhouse muscle to dominate the movement. Less glute max recruitment means we're forcing the glute medius and minimus to do more of the work, helping us to get more out of the clamshell exercise. And hey, real quick, I'm an independent content creating physical therapist who does all of this stuff himself since I have an extraordinarily tight budget. I love what I do. My goal is to simply help you live a stronger, less pain-riddled life. And so if you appreciate that I'm creating authentic content that isn't AI slop, and that you're watching content created by a human being who isn't hiding his face or using a fake voice, then feel free to hit the like button to help spread the word that getting out of pain is possible. All right, let's get on to the final mistake to avoid. The third mistake to avoid is lifting your knee up so high during the movement that it rotates your torso backwards in the process. If this happens, you'll start bringing in all sorts of extra muscles into the movement, including, you guessed it, glute max. And since the clamshell is an exercise that's designed to primarily pick on the glute medius and glute minimus, we want to avoid this. When you keep your torso pointed downwards and don't allow it to rotate backwards during the movement, you'll be confined to a smaller range of motion, but don't confuse this with a less effective muscle contraction to the glute medius or its baby brother, the glute minimus muscle. If your goal is to pick on glute medius and minimus as much as possible, especially as a rehabilitative exercise intervention, then a larger range of motion with the clamshell is not necessarily more effective. All it's doing here in this case is achieving this added range of motion through utilizing additional muscles we're not interested in using. Again, to be clear, there's nothing bad with this, as you'll still make some good things happen for your hip, but if for your specific situation you need to pick on medius and minimus, then keep your torso pointed downwards throughout the movement. So when done with the intention of picking on glute medius and glute minimus, it actually works out to be a very small range of motion that we achieve from the movement. And when we confine the movement like this, it is surprisingly tiring and often doesn't take any extra resistance from using bands. So the recap, 30 degrees of hip flexion, aim your belly button towards the ground before starting the movement, and don't let your torso rotate backwards as you lift your knee. And if you follow all 3 of these steps, you'll greatly diminish glute max's ability from taking over and dominating the movement, allowing you to waste less time when it comes to finding ways to strengthen 2 of your deep hip stabilizers that are critical for optimal hip health and lumbopelvic function. All right, stick around if you want some extra details. Okay, so with the meat and potatoes out of the way, there's a few other things that I'll quickly mention. So for starters, keep in mind that with a therapeutic exercise like this, you'll always be getting multiple muscles firing when you perform the movement. All 3 gluteal muscles will be working as a team, along with numerous other deep muscles of the hip, So don't think that this is a perfect isolation that we're driving into only one or two muscles. The goal here is to simply force glute medius and glute minimus to work as much as possible, since this exercise is primarily intended for these muscles. Again, it's worth mentioning that it can absolutely be worth performing hip rehab exercises that do pick on the glute max muscle while challenging the smaller gluteal and hip muscles as well. And this is because it's a bit more of a real-world functional demand of the hip when we do this. But again, for the purposes of this video, we're simply trying to optimize the clamshell performance for the smaller gluteal muscles. Additionally, exercises such as lateral walks and monster walks are great exercises for the gluteal muscles. And the thing to keep in mind here is that yes, glute medius and minimus will abduct the hip here, but there's also a lot of glute max activation here, since glute max is a very powerful hip abductor. So this is great for functional strengthening, but perhaps less ideal if looking for a hip exercise that can focus more on smaller gluteal muscles while keeping glute max from contributing. Okay, so going back to the clamshell exercise, if you're used to using bands when performing this exercise, you certainly can. However, depending on your overall hip health and how you've been previously performing your clamshells, you may be surprised just how much effort it can take to perform the clamshell without a band when you avoid the 3 mistakes that I've just mentioned. As such, don't worry if you need to forego bands for the first bit, as this is a common thing that I see when I help optimize clamshell movement for many of my patients. And the bands will always be there for you when you're ready for them. Now, when it comes to how many sets and repetitions you should perform, this is highly variable based on each individual's condition and overall circumstances. But the general rule here is you want to always be performing this movement quite slowly. And if you want more of a challenge, you can hold the contraction at the top position for a few seconds before lowering back down to the starting position. And again, sets and reps are highly variable, but if you're going really slow and you're doing 2 or 3 sets and you're getting about 10 to 12 repetitions at a slow pace, that might be an ideal kind of starting point for most individuals. I can't say specifically, but again, if each set is taking about 10 to 12 repetitions and it takes about a minute to perform a single set, it's probably going to be a pretty good stimulus for most individuals. But again, you'll have to play around with it a bit or get advice or insight from a professional whom you're working with to fine-tune it specifically for your needs. Now, I've got a lot of other hip content on this channel, so if you want to check out another outstanding hip exercise, check out this video right here, or maybe it's here, which will load you up with more very helpful content for optimizing the health of your hips. And in the meantime, you know how it goes. Keep looking after yourselves, keep looking after one another, keep making great things happen, and I'll see you in the next video.